Welcome to Module 1 of our course on community-based clinical health. In this module, we are going to build a strong foundation by first understanding what community-based health is, why it has become such an important approach in today's world, and how it differs from traditional, hospital-centered models of care. We will also explore how social and economic inequalities influence health outcomes, and why a community-focused approach is often the most effective way to improve population well-being. Finally, we will study the guiding principles of community-based health, including recognition of community strengths, the Alma Ate Declaration, and the values of equity, justice, health for all, and participation. Section 1: An overview of community-based health. Community-based health refers to a model of healthcare delivery where the community itself becomes the focal point of both planning and service delivery. Instead of concentrating all care within hospitals or clinics, community-based healthcare brings services closer to people's homes, workplaces, and schools. This approach emphasizes accessibility, cultural sensitivity, prevention, and participation. In many countries, especially in developing regions, community-based health programs have proven essential in addressing widespread health needs at a lower cost and with greater impact. At its heart, community-based healthcare recognizes that health does not depend only on medical interventions but also on social, economic, and cultural factors. By involving the community in planning and delivery, healthcare becomes more relevant, acceptable, and sustainable. Section 2: Alternative approaches to traditional practice. Traditional healthcare systems are often hierarchical, hospital-based, and doctor-centered. They tend to focus on treating diseases after they occur rather than preventing them. Community-based health offers an alternative. Instead of seeing patients only when they arrive at a hospital, this model emphasizes outreach, education, and preventive measures. For instance, community health workers may visit households to provide basic first aid, maternal care, or health education. Mobile clinics may serve rural areas with no permanent facilities. Community programs may encourage immunization, nutrition, hygiene, and safe water practices. This does not mean traditional hospitals and clinics are irrelevant. Rather, community-based health complements them by addressing needs before they escalate into serious conditions. Together, they form a holistic healthcare system. Section 3: Health and lower socioeconomic backgrounds. One of the strongest justifications for community-based health is its ability to address inequalities. Individuals from lower socioeconomic backgrounds often face multiple barriers to accessing health services. These barriers may include financial constraints, inability to pay hospital fees, geographical barriers, long distances to hospitals, cultural barriers, language differences or mistrust of formal systems, educational barriers, lack of knowledge about available services. Community-based health helps bridge these gaps by bringing services directly into communities, offering low-cost or free interventions, and engaging local leaders who are trusted by the people. For example, community midwives have saved countless lives in poor regions by providing safe childbirth practices where hospitals are out of reach. Similarly, vaccination campaigns succeed when they are rooted in community mobilization rather than distant directives. Section 4: Principles of community-based clinical health. Community-based clinical health is guided by several important principles. Accessibility: services must be available to everyone, regardless of income, location, or social status. Prevention: preventing illness is more effective and less costly than treating disease after it develops. Participation: communities must be actively involved in decision-making, planning, and implementation. Cultural relevance: services should respect and adapt to local beliefs and practices. Sustainability: programs should be designed to last, using local resources and capacities wherever possible. These principles ensure that healthcare is not just delivered to communities but with communities, making them partners in the process. Section 5: Recognition of community knowledge and strength. One of the greatest strengths of community-based health is the recognition that communities themselves hold valuable knowledge. Traditional healers, local midwives, elders, and community leaders often possess deep understanding of health practices, cultural beliefs, and social dynamics. Ignoring this knowledge can create resistance, but respecting and incorporating it builds trust. For instance, when global health programs integrate local herbal remedies alongside modern medicine, or when they engage village leaders to promote sanitation campaigns, the adoption of healthier behaviors becomes far more successful. This principle emphasizes humility. Healthcare providers should not come into communities as experts alone, but as partners who listen, learn, and collaborate. Section 6. The Alma Ata Declaration. In 1978, the World Health Organization and UNICEF held a historic conference in Alma Ata, Kazakhstan, where they declared primary health care to be the key to achieving health for all. The Alma Ata Declaration emphasized equity in health services, universal access to basic care, community participation in decision-making, intersectoral collaboration across education, agriculture, and housing. This declaration laid the foundation for modern community-based health approaches. Its vision was bold: health is a fundamental human right, and no one should be denied care because of poverty, geography, or social status. Although challenges remain today, the Alma Ata principles continue to inspire policies and programs worldwide. Section 7. Core values: equity, justice, health for all, and participation. Let's now explore the 4 cornerstone values of community-based health. Equity: this means fair distribution of health resources. It does not mean giving everyone the same thing, but ensuring that those with greater needs receive more support. For example, rural communities may require more mobile clinics than urban areas. Justice: health systems must be fair and accountable, protecting the rights of vulnerable groups such as women, children, the elderly, and people with disabilities. Health for all: this global vision insists that healthcare is a right, not a privilege. Every policy, whether local or international, should be measured against whether it helps achieve this goal. Participation: true health programs empower communities to lead. Participation builds ownership, ensuring that projects last even after outside support ends. Together, these values form the moral and ethical foundation of community-based health. Conclusion to Module 1. In this first module, we have examined the foundations of community-based clinical health. We began with an overview of its meaning and purpose, contrasted it with traditional healthcare models, and explored its special importance for marginalized populations. We also discussed the guiding principles, the recognition of community knowledge, the influence of the Alma Ata Declaration, and the core values of equity, justice, health for all, and participation. As we move to Module 2, we will shift from principles to practice. We will focus on the community as the central unit of healthcare, the characteristics and objectives of community-based health services, the roles of health workers, and the strategies and frameworks that guide successful implementation.